Hello everyone. Today we are going to learn about nutrition assessment. Nutrition assessment is a very important topic for nutritionists and dietitians. The topic outcomes are, that is, by the end of this topic, you should be able to 1. Define the key terms used in nutrition assessment. 2. State the importance of nutrition assessment. And finally, describe the direct and indirect nutrition assessment techniques. Let us start by defining the terms. The first term is nutrition assessment. What is nutrition assessment? It is defined as a systematic process of obtaining, verifying, and interpreting data in order to make decisions about the nature and cause of nutrition-related problems. The next term is nutrition screening. This is another term that is related with the first one, nutrition assessment, but what is its definition? It is defined as a process. It is defined as a process of identifying characteristics known to be associated with nutritional problems. So what are the purposes of nutrition assessment? What are the purposes of nutrition assessment? The first one is, it's actually meant for diagnostic purposes. That is, to identify individuals or population groups who are malnourished and those at risk. The second one is, it is actually meant to monitor effects of nutrition intervention. That is, after prescribing a diet, for example, you should be able to monitor the effect of that diet after you have given that diet to your patient. So this is actually meant to measure the effectiveness of the nutritional program. The next one is to develop healthcare programs that meet the community needs, which are defined by the assessment. Nutrition assessment is also used as a targeting tool. That is, it can provide information that can be used to target a given group. It is also used to identify nutritional problems in a community early enough for prompt action to prevent them from worsening. It is also used as a proxy indicator of socioeconomic status. And finally, nutrition assessment is used to evaluate tools used in tracking trends over time. Let us now look at the types of nutrition assessment techniques. Nutrition assessment techniques or methods can be grouped as either direct or indirect. Direct methods deal with individuals and measures objective criteria. They include the following one: anthropometric assessment, which is the assessment of body dimension like the weights or heights. The second one is biochemical assessment, where we assess the body components like the blood to determine the nutritional status of an individual or a nutrition-related condition. The third one is clinical assessment, where you try to look at the signs and symptoms of a possible nutritional problem. And finally, dietary assessment, where we assess the feeding patterns of individuals to determine their nutritional status. The next category of techniques is the indirect method. This uses community indices that reflect the community's nutritional status or needs. And they include one, ecological variables, for example, agricultural crop production or crop yield. The second one is the economic factors, which include household income, per capita income, population density, food availability, and even the food prices. And finally, the third one, cultural and social habits, For example, in our Kenyan culture, there are some communities that prohibit women, or it is a taboo for women to consume eggs, and this may actually affect the nutritional status of women. Now, there are equipments that are used for nutrition assessment. One of them is the height board. That is the height board, which is portable. And we also have the stadiometer that is used to measure both height and weight for adults. We also have the length board that is used to measure the recumbent length. That's for babies. And that is it. There's also what we call the MWAC tape, which is mid-upper arm circumference tape. That is it. And it is used to screen children at risk of malnutrition. Weight is also another important parameter that we measure during nutritional assessment. And the following are the weighing machines. We have the beam balance, we have the bathroom scale. The two are meant to measure weight for adults. And for babies, we have the digital baby weighing scale. Wow, that is the bathroom weighing scale for adults. And that is the digital baby weighing scale for babies. Other equipment include the non-stretchable tape measure. That's just like the Taylor's tape measure. The skin fold calipers. The bioelectric impedance machine. Food diaries. And finally, the dietary diversity score. What should we consider when we are choosing a nutrition assessment method or a nutrition assessment technique? When choosing nutrition assessment technique or method, we should consider the following: reliability, time it takes, the cost of that equipment or machine, the number of respondents that you are going to assess, and finally, accuracy. And that is the end of our topic. Thank you very much.